Good morning, afternoon, evening. I am Shiva Chatterjee from Workspertise and will be moderating this event. We welcome you, our audience, and the panelists to this webinar titled Robotic Process Automation in Healthcare. We've planned for an engaging and thought-provoking session to review the evolving of the US healthcare landscape and also to discuss the criticality of automation and managing automation support and technology deployments. To illustrate the point, if you look at this infographic, you will see we spend about 17%, 16.9 of our GDP in healthcare, and yet our life expectancy in terms of the health outcome is the worst. We're at 78.6 years of life expectancy compared to Switzerland, which is at the top at 83.6. We're right here. So, something therefore is not quite right.
So hopefully that'll sort of set the context for what we're talking about today. So the first thing I want to talk about is the demographics of demand. And so again, you can read the slide for yourself, but here's what's the important piece of the slide is that with the young, there's less loyalty, right? In the past, maybe my sort of generation, there's a lot of loyalty to a particular physician or a particular enterprise. That's no more. It's all about convenience. And at the same time, as we age and as we get more, maladies that happen, chronic disease, the demand is going to continue to increase for healthcare. Those are the two takeaways. So what do you do? What needs to be done about that is really be omni-channel, multi-channel in terms of the ability where to get care, and then also the personalization of care. That's going to be a key difference with the younger generation. So that's really about the demographics of demand. Now we're going to move over to economics. So the economics of inaction. So a couple things, right? Exploding costs. Shabu showed a great chart on that. Not much more needs to be said about it, just how much that we pay. And we continue to age, right? As a society, we're living longer. And so as a result, the economics really take a hit in terms of the percent of GDP. So what should we be doing about it? What needs to be done about that? Really a lot more focus on prevention and a lot more focus on wellness and efficiencies, administrative efficiencies, operational efficiencies. So I'm not talking specifically about robotic process automation, but I think as you hear me speak and look at these slides, like myself and the organizations where I serve, we're thinking about, okay, how do you achieve a lot of these things? And a lot of it does come down to leveraging RPA. So also data analytics into being a lot more prescriptive instead of sort of reactive. So those are the economics of inaction.
And for technology. So this is a perfect segue for Gokul Solai to take over. And just as a brief introduction, Dr. Solai is a medical MD, and he's the CEO of Novatio Solutions. And Gokul, over to you, please.
Yeah, thank you, Shiva. And before we start, just wanted to echo your sentiments and gratitude for everyone involved here and the panelists. So just to give you a little bit of context, Ed really talked through a lot of the motivators and the driving factors from a top-down level, and I hope to bridge the gap there by taking a bottom-up focus. With that in mind, I really thought through how we can utilize technology to add these efficiencies. And there's a lot of ways to approach this. When we think of medicine, triads are always there, and the reason is you can't just stick one diagnosis or symptom or attribute and tell you what's going on. If you've got, let's say, right upper quadrant pain and a fever and increased white blood cells, people think you have to get your gallbladder out, right? But you can't make that determination by just saying, hey, the upper right part of my stomach hurts. There's a lot of causative factors that can go in there. And what we really need to do is narrow this down and find out, hey, where's the core problem? And as Ed mentioned, it's a cost, quality, and convenience piece. as well, and how do we solve around that triad is kind of the motivations that we see.
Next panelist
So,
is
if we look
Mr.
at
Eric Hochstein. He's the Vice President of Business Development at ChoiceWORX, and he'll discuss robotic process automation management and production support. And so over to you, Eric.
Thank you, Shibu. And Gokul, your concept of digital clones doing, let's go to that first slide, please. Digital clones doing the work of people across the range of applications in the industry is so true. And it's explaining to us why automation is so important to healthcare success in the future. And we have to recognize, as you mentioned so much, that the RPA yields are much more than just cost and efficiency benefits, but it's transforming the way that healthcare is delivered. And we saw with those results from the last survey that most people in the audience talked about, answered that it was the efficiency that was the most important thing.
Leads to is we need to take that same passion and vigor and apply it to the clinician experience. So just as the patient is not having a great experience because of all the manual, workarounds and things like they have to deal with, for many of the clinicians and many of the world's organizations, it's the same way. So we're not really allowing them to operate atop of license because they have to do a lot of manual things in order to keep the clinical workflow moving forward. And so this area is ripe for clinical, for intelligent automation as well, because today there is a lot of manual processes that are part of the issue with burnout.
Thank you. And so now we're at 11:59, so I've got one more minute. The last question is a yes, no, please, and this is to probably, to Eric, and then we'll do a wrap up. So does ChoiceWORX automatically fix bot issues in life? Yes or no?
Yes, certain issues, those issues, that's more than a yes or no. Certain issues we do fix relating to devices. If a bot isn't running, for example, because there's too much memory being used on the host device, we're able to clear that host, identify the problem, then clear the host device memory appropriately.
Okay, terrific. So it's 12 noon, and I'd like to wrap up the session by thanking the audience, the panelists, and behind the scenes support. Please feel free to contact us for any questions, learnings, or demos on our PAM. A recording for this session will be available, and we will email you a link. We'll also circle back with you regarding your feedback and look forward to future engagements. Thanks again on behalf of Workspertise, ChoiceWORX, the speakers, and ERPA, and enjoy the rest of your day. Goodbye.